Okay, so here's a website from the CDC.gov. The CDC, Centers for Disease Control and Prevention, based in Atlanta, Georgia. Uh, they've been in the news lately a lot. You see the CDC director, I think Dr. Redfield or something like that. His name is. He's usually up there in the podium with President Trump giving briefings. Anyway, so let's go back here. Global health, China, right? Now, why am I doing this? You see some Chinese people here. The U.S. Centers for Disease Control and Prevention, CDC, and the government of China have collaborated for the past 30 years, addressing public health priorities affecting the U.S., China, and the world. Through the decades, the CDC China office has evolved the focus of its technical assistance towards strengthening global health security. As the country improved its ability to prevent, detect, and respond to disease outbreaks, the government of China has been able to provide global health security support to other countries. Sounds nice, right? Because remember when they had SARS that originated in China, and from time to time, China China tried to hide that disease that was going on, that was killing people, and it eventually got out of China and was spreading around the world. All right, so here we have CDC impact in China, surveillance and operational research on foodborne diarrheal infections, healthcare associated infections, respiratory diseases, and viral hepatitis have increased awareness about antibiotic resistant organisms, identify risk factors for disease transmission, and help reduce underreporting of infections, supported the development of evidence that contributed to a major revision of China's seasonal influenza vaccination policy in 2018. 70 China FETP graduates hold leadership positions at public health agencies in the country. More than 20 China FETP graduates deployed during the 2014 to 2016 West Africa Ebola outbreak. China, top 10 causes of death. Number 1, stroke. 2, ischemic heart disease. 3, chronic obstructive pulmonary disease. Right? That's with the lungs. Something you get, people who smoke a lot tend to get something like that. Chronic obstructive pulmonary disease. A lot of smoking going on in China. 4, lung cancer. 5, Alzheimer's disease. 6, liver cancer. 7, stomach cancer. 8, hypertensive heart disease. 9, road injuries. 10, esophageal cancer. That is cancer of the stomach. Okay, so let's see here. What CDC is doing in China? Okay, so they have global health security, field epidemiology training program, which has to do with studying different diseases, influenza, emerging infectious diseases, right? Like what's going on right now, emerging infectious disease, tuberculosis, Global Health Corporation. So let me just click on this here, since we have the coronavirus going on right now. Emerging infectious diseases. This is where this will come in handy, the CDC in China. Enhancing China's ability to contain infectious disease outbreaks before they spread globally is a shared priority of the US and China. CDC collaborates with China's CDC to improve its ability to detect and respond to emerging infectious diseases, including through surveillance sites in healthcare facilities. Increased collaboration with human and animal health sectors has furthered the One Health concept of recognizing that the health of people is connected to the health of animals and the environment. This approach aims to reduce human diseases burden due to rabies, brucellosis, and other zoonotic diseases. Zoonotic, like a zoo, meaning animals, diseases caused by the animals. So, what we have going on in China now, supposedly, bats might be responsible, or the pangolin, a scaly type animal, for transmitting the novel, that coronavirus. They call it novel, the new one, since we hadn't seen it before. So this sounds all fine. And then the reason I'm going through this is for a reason, because when you listen to President Trump, sometimes he would say, we had no idea. We were caught off guard, we were blindsided. We didn't see this coming. So there the CDC is saying, yeah, they are in China, right? So CDC staff in China, 3 U.S. assignees, 11 locally employed. China at a glance, population 1.39080. So that's 1.39 billion people in China. Per capita income 16,760 US dollars. Life expectancy at birth for female 78, for male 75. Infant mortality rate. So there are like 10 deaths out of every 1,000 live births in China. Okay, so that's from the US CDC. Now, let's go over here. There's an article here from Reuters. I'm sure we heard of Reuters. The US news service, Reuters. So Washington. This article was written, let me see, 5 days ago. This was March 25th, 2020. And today that I'm reading this is March the 31st. Right? Yeah. So this was, that's 5 days ago. Exclusive. US/CDC staff inside China prior to coronavirus outbreak. So just remember what I just read. One of the reasons the CDC had an office in China was to prevent things like what's happening right now. So they had boots on the ground. So if there's an outbreak, viral or so forth, anything that could be contagious, that could spread globally, they're underground and they could contain it. It's like having policemen or firemen right in the compound, whereby if a fire breaks out, your firemen are right there. You don't even have to call them; they're right there. They can contain the fire and put it out. Or policemen, if crimes are being committed, your policemen are right there on the compound and the premises, and they can put down the crime. They can deal with it. So we read what happened, what the CDC said, why they're in China, their purpose. Now this article is saying the Trump administration cut staff by more than 2/3 at a key U.S. public health agency operating inside China as part of a larger rollback of U.S.-funded health and science experts on the ground there, leading up to the coronavirus outbreak, Reuters has learned. Most of the reductions were made at the Beijing office of the U.S. Centers for Disease Control and Prevention (CDC) and occurred over the past 2 years, according to public CDC documents viewed by writers and interviews with 4 people familiar with the drawdown. The Atlanta-based CDC, America's preeminent disease-fighting agency, provides public health assistance to nations around the world and works with them to help stop outbreaks of contagious diseases from spreading globally. It has worked in China for 30 years. The CDC's China headcount has shrunk to around 14 staffers, down from approximately 47 people since President Donald Trump took office in January 2017, the documents show. The 4 people who spoke on condition of anonymity said the losses included epidemiologists, those are people who study diseases, and other health professionals. The material reviewed by Reuters shows a breakdown of how many Americans and local Chinese employees were assigned there. The documents are the CDC's own descriptions of its headcount, which it posts online. Reuters was able to search past copies of the material to confirm the decline described by the 4 people. So let me just stop here. So Reuters just didn't take their word for it and say, well, maybe these people just complaining. Maybe they don't like Trump. Who knows? So Reuters went back and looked at CDC's own document for the past to confirm, to see, to collaborate or corroborate what these people are saying, whether it's true or not. The CDC office in Beijing is a shell of its former self, said one of the people, a U.S. official who worked in China at the time of the drawdown. Separately, the National Science Foundation and the United States Agency for International Development, the Global Relief Program, which had a role in helping China monitor and respond to outbreaks, also shut their Beijing offices on Trump's watch. Before the closures, each office was staffed by a U.S. official. In addition, the U.S. Department of Agriculture, USDA, transferred out of China in 2018, the manager of an animal disease monitoring program. Reductions at the U.S. agencies sideline health experts, scientists, and other professionals who might have been able to help China mount an early response to the novel coronavirus, as well as provide the U.S. government with more information about what was coming, according to the people who spoke with Reuters. The Trump administration in February chastised China for censoring information about the outbreak and for keeping U.S. experts from entering the country to assist. Right, that's true. We know that the U.S. government wanted to send people to China to see what's going on. China refused. But the U.S. government already had an office there, but they cut staff. So if they were in the country already, it would be much easier to work with their Chinese colleagues on the ground, you know. So if something's going on in China and you're already there in the country and you have an office, it's much easier to find out what the hell is going on than China, because it's not that easy to send somebody into China, especially government officials, you know. To get into China, you have to get visas and all that stuff. Whereas if you're there already in China and you have an office and you're working with the CDC, then sure, it's not a problem. So we had a large operation of experts in China who were brought back during this administration, some of them months before the outbreak, said one of the people who witnessed the withdrawal of U.S. personnel. You have to consider the possibility that our drawdown made this catastrophe more likely or more difficult to respond to. The White House declined to comment or respond to questions from Reuters regarding the U.S. withdrawal of staff in China. See, that's it. Now, if a reporter from Reuters were to ask that question during one of those press conferences that Trump gives, he probably called it fake news. He probably said that's fake news. But the White House declined to comment. So they brought all these people back from China who could have been like I said, like if a fire breaks out and you have firemen right there, they can easily put out the fire. Or policemen right on the compound, they can easily handle the crime that's going on. And that the job of the CDC. So the CDC did not respond to detailed questions submitted by Reuters about the cut. It has insisted its staffing levels did not hinder the U.S. response to the coronavirus. Well, we know that's not true. And of course, the CDC, now they're under the Trump administration, so of course, they're not, they're not going to answer these questions like that. They're not. They're going to have to deal with the White House. And anybody who does answer truthfully most likely will be fired. You see? But the point is, if the CDC had people in China, believe me, chances are what's going on right now all over the world probably won't be happening. There are many factors that go into this decisions around staffing, the CDC said in a statement. Some health experts were skeptical that more CDC employees operating inside China would have made a difference in stemming the outbreak. Beijing has been widely criticized for silencing its own public health officials who warned of a deadly new respiratory disease emanating from the Chinese city of Wuhan and surrounding Hubei province. The problem was China, not that we didn't have CDC people in China, says Scott McNabb, a former CDC epidemiologist who is now a research professor with Emory University. He pointed to China's censorship as the main culprit in the spread of the pandemic, which has infected at least 435 and 470 people worldwide, killed 19,598, and upended the global economy. China's embassy in Washington, D.C. declined to comment. Shuttered offices. The NSF closed all foreign offices in 2018, according to spokesman Robert Magetta. He said the agency planned on sending teams on a short-term expedition around the world to find ways to increase international collaborations. A USAID spokesman said the decision to shutter its Beijing office was due to significantly decreased access to Chinese government officials, as well as the agency's position that the Chinese model of development is not aligned with U.S. values and interests. The USDA confirmed that it moved a manager position out of Beijing. A spokesman said the department has retained an office in China that employs 8 people, 5 Americans and 3 Chinese. The office monitors animal disease and helps resolve trade-related issues as they occur at Chinese ports of entry, the spokesman said. Reuters first reported about changes to CDC staffing in China on Sunday. The news agency revealed that the Trump administration had eliminated the position of a U.S. trainer of Chinese field epidemiologists who were deployed to the epicenter of the outbreaks to help track investigate, and contain diseases. In a press briefing on Sunday, Trump criticized the Reuters story, as 100% wrong. Yet the CDC acknowledged the position had been cut. The agency said the decision was made because of China's excellent technical capability, and said the elimination of that post did not hamper the U.S. effort to respond to the coronavirus outbreak. The CDC staffing documents newly reviewed by Reuters show a sharp decline in the overall number of employees at the agency in Beijing, with 33 out of 47 positions lost. Wow, 33 out of 4. So that means there are like 14 people left. 33 people are gone out of 47 positions. So they're down to 14. The documents show the breakdown between American and Chinese staffers. The number of so-called American assignees declined to 3 positions from 8 at the outset of the administration. Positions lost included medical epidemiologists and other experts in infectious diseases. The biggest cuts were to positions filled by Chinese employees on the U.S. payroll, down to about 10 from 40 over the same period. All right, so they go from 40 to 10 employees. So of course, if you have local Chinese people working with you who know the language and can get around, maybe it's much easier to solve the problem if a problem arises. That's what I would say. It would seem more possible that way. That if you have, so you go from 40 Chinese to 10 Chinese on the ground. And China is a very big country. Many of those local hires included medical and disease experts, according to the people who spoke with Reuters. Local staffers stayed even longer at the CDC and had a real depth of knowledge, one of the people said. There's a loss of deep expertise and institutional knowledge. The CDC told Reuters the 3 Americans currently on staff in China are a country director, an influencer expert, and an information technology expert, right? Information technology, people who deal with computers, data, and so forth, which has nothing to do with fighting diseases, right? So you have these 3 people. What are they really going to do when it comes to stopping this disease from getting out of hand? A temporary deputy director arrived recently, and that job will be filled permanently, the agency said in a statement. In addition, 2 Chinese staffers continue to work on specific public health areas, including the training program, according to the statement. The shuttered USAID and NSF offices in China also had a role in building scientific relationships and combating global disease, according to the 4 people familiar with the situation. USAID's Beijing office, which was staffed by a senior U.S. officer and 2 Chinese employees, was working on initiatives including multi-drug resistant tuberculosis and malaria, the people said. The office closed in 2019. The NFS office was once led by Nancy Song, a respected American scientist who was a key link between the U.S. and Chinese scientific communities, according to the U.S. government official who spoke with Reuters. The office also employed 2 local staffers. She She had far more contacts than most of us, said the official, who had been in China at the time and was familiar with her role. She could have helped maintain vital channels of communication between the two countries, which to this day is greatly curtailed. Song, who is now with the NSF in the United States, declined to comment about the closure of her office in 2018 and referred questions to the agency's public affairs office. So she doesn't want to comment. But the point is, she was an expert. She was like a liaison, and when you have the right person in the right place at the right time, you can do a lot of stuff. And had she been there, more than likely, people might have been more forthcoming with what was going on with this in Wuhan, China, with the outbreak of the novel coronavirus. So she doesn't even want to talk. She just say, just go to the agency's public affairs office, speak to them, without benefit to the U.S. The changes came amid escalating tensions between Washington and Beijing. Trump has long complained that China has stolen millions of American jobs and intellectual property, charges the Chinese government has rejected as baseless. The countries have slapped billions in tariffs on each other's goods. Now, their leaders are battling to control the narrative over the pandemic. Trump has called it the Chinese virus to keep the focus on China's role in unleashing the pandemic. China, meanwhile, is trying to assert global leadership by providing aid to Italy and other hard-hit countries. Over the last 2 years, the White House has pushed U.S. agencies with a presence in China to fund programs there, along with positions to manage them, according to the U.S. official who spoke to Reuters. The source said Terry Branstad, the U.S. ambassador to China and a former Republican governor of Iowa, tried to remind the White House of the importance of the U.S. presence in China, but was told to get with the program. Get with the program. So here was this Republican ambassador in China is saying, look, the importance of being in China, and they tell him, get with the program. This is how it's going to be. Get with it. The White House saw the relationship as one-sided and without benefit to the U.S., the source said. A State Department spokesman said in a statement that the U.S. Embassy in China is one of our largest, reflecting the many areas of bilateral engagement. Since Ambassador Branstad's arrival, the U.S. mission to China has maintained robust staffing to advance important foreign policy goals on behalf of the American people, the statement said. Staffing levels for the numerous federal agencies and sections have, on the whole, held steady and in some cases increased. After Reuters' story about the elimination of the key CDC position in China ran on Sunday, Trump's re-election campaign seized on it for fundraising. In a mass email to supporters, it accused Trump's critics of siding with the Chinese and helping Beijing with a cover-up. The CDC on Monday told Reuters that Redfield had decided to add a global health threat program director to his China office, to his China staff. At the request of Dr. Redfield, CDC is continuing to look long-term at possible additions to enhance CDC's 30-plus year presence in China. the statement said. All right, so there it is. There's one other article here. I'm just going to go to this. This is from foreignpolicy.com. And they're saying Trump has sabotaged America's coronavirus response as it improves its way through a public health, as it improvises its way through a public health crisis. The United States has never been less prepared for a pandemic. Okay. So this article is basically reiterating that the U.S. pulled out the CDC's personnel that could have made it different. Let me see, what's the date on this article? This is this is going back to January. This was January 31st, 2020. So this was written all before all this stuff is happening now. You see, I mean, this was January 31st. And when this was written about Trump has sabotaged America's coronavirus response, most people in America didn't see what's going on. You know, like right now, like in New York, for example, refrigerators with dead bodies, hospitals so full, doctors, nurses overworked. We didn't have any of that going on. So this was January the 31st, 2020, right there, when this was written. If you go back to January 31st, 2020, nobody yeah, I think the only news that was around was the doctor in China, in Wuhan, who was arrested for spreading fake news about the virus. And then later on, he died. Since then, the Chinese government said they're sorry. It was a mistake. So if you go back then, even then, by then, when Trump in his rallies, he was going around, I think it was in North Carolina sometime, and he was saying this is a Democratic hoax. This whole idea of this virus, it's a hoax. You see? So this article was written way back then. Now you see what's going on. Now the government is spending what? Borrowing like a few $1 trillion to send, like if you're single and you make less than 90,000 or less, you get $1,200. Propping up the airline industry. Don't you think it would have been better? It would have been much cheaper if Trump had left the budget, or maybe increased the budget, and maintain the staffing of the CDC in the Beijing office in China. That would be much better. Like there's an old saying, penny wise and pound foolish. That means you're trying to save a few pennies, and then in the end, you end up spending you spend a lot more money for what you think you could have saved. You see? So they say the epidemic control efforts unfolding today in China, including placing some 100 million citizens on lockdown, shutting down a national holiday, building enormous quarantine hospitals in days' time, and ramping up 24 hours manufacturing of medical equipment are indeed gargantuan. It's impossible to watch them without wondering, what will we do? How would my government respond if this virus spread across my country? Well, good, because now we're seeing, this was written back in January 31st. Now we're seeing what's happening. For the United States, the answers are especially worrying because the government has intentionally rendered itself incapable. In 2018, the Trump administration fired the government's entire pandemic response chain of command, including the White House management infrastructure. In numerous phone calls and emails with key agencies across the U.S. government, the only consistent response I encountered was distressed confusion. If the United States still has a clear chain of command for pandemic response, the White House urgently needs to clarify what it is, not just for the public, but for the government itself, which largely found itself in the dark. When Ebola broke out in West Africa in 2014, President Barack Obama recognized that responding to the outbreak overseas, while also protecting Americans at home, involved multiple U.S. government departments and agencies, none of which are speaking to one another. Basically, the U.S. pandemic infrastructure was an enormous orchestra full of talented, egotistical players, each jockeying for solos and fame, refusing to rehearse and demanding high salaries, all without a conductor. To bring order and harmony to the chaos, rein in the agency egos, and create a coherent multi-agency response overseas and on the home front, Obama anointed a former vice presidential staffer, Ronald Klain, as a sort of epidemic czar inside the White House, clearly stipulated the roles and budgets of various agencies, and placed incident commanders in charge in each Ebola hit country and inside the United States. The, the orchestra may have still had its off-key instruments, but it played the same tune. Building on the Ebola experience, the Obama administration set up a permanent epidemic monitoring and command group inside the White House National Security Council, the NSC, and another in the Department of Homeland Security, both of which followed the scientific and public health leads of the National Institute of Health and the Centers for Disease Control and Prevention, CDC, and the diplomatic advice of the State Department. On the domestic front, the real business of assuring public health and safety is a local matter, executed by state, county, and city departments that operate under a mosaic of laws and regulations that vary jurisdiction by jurisdiction. Okay, so let's go down here. In the spring of 2018, the White House pushed Congress to cut funding for Obama-era disease security programs, proposing to eliminate 252 million, which is peanuts, by the way, in a budget that's about $4 trillion. So there it is. The White House pushed to eliminate 252 million in previously committed resources for rebuilding health systems in Ebola-ravaged Liberia, Sierra Leone, and Guinea. Under fire from both sides of the aisle, President Donald Trump dropped the proposal to eliminate Ebola funds a month later, but other White House efforts included reducing $15 billion in national health spending and cutting the global disease fighting operational budgets of the CDC, NSC, DHS, and HHS, and the government's $30 million Complex Crises Fund was eliminated. See, in May 2018, Trump ordered the NSC's entire global health security unit shut down. Right? So Trump ordered it shut down, calling for reassignment of Rear Admiral Timothy Zima and dissolution of his team inside the agency. The month before, then White House National Security Advisor John Bolton pressured Zima's DHS counterpart Tom Bussard to resign along with his team. Neither the NSC nor DHS epidemic teams have been replaced. The global health section of the CDC was so drastically cut in 2018 that much of the staff was laid off, and the number of countries it was working in was reduced from 49 to 10. Meanwhile, throughout 2018, the U.S. Agency for International Development and its director, Mike Green, came repeatedly under fire from both the White House and Secretary of State Mike Pompeo. And though Congress has so far managed to block Trump administration plan to cut the U.S. Public Health Service Commission call by 40%, the disease-frightened cadres have steadily eroded as retiring officers go unreplaced. So this is what we have right now. Public health advocates have been ringing alarm bells to no avail. Klain has been warning for 2 years that the United States was in grave danger should a pandemic emerge. In 2017 and 2018, the philanthropist billionaire Bill Gates met repeatedly with Bolton and his predecessor, H.R. McMaster, warning that ongoing cuts to the global health disease infrastructure will render the United States vulnerable to, as he put it, the significant probability of a large and lethal modern-day pandemic occurring in our lifetime. And an independent bipartisan panel formed by the Centers for Strategic and International Studies concluded that lack of preparedness was so acute in the Trump administration that the United States must either pay now and gain protection and security, or wait for the next epidemic and pay a much greater price in human and economic costs. Wow. It sounds like I'm reading from the works of Nostradamus. Anybody may remember Nostradamus? The man who way back, I think was what, the 18th century or something like that. He made lots of predictions that supposedly came through. And now they're saying here that next epidemic is here. We'll soon know the cost imposed by the Trump administration, early negligence and present panic. So that's it. So January 29, Trump announced the creation of the president's coronavirus task force. Well, that's too late. An all-male group of a dozen advisors, 5 from the White House staff. So this is where we are. Trump had warnings. Trump took it lightly. He's claiming that he didn't see it coming. No, the records show that this administration was told, was warned that, hey, you keep cutting on the global level, you may suffer human loss, and your economy will be affected. Trump took a gamble, and that's where we are. So now we have what? They passed over what is it, $2.2 trillion, something like that, bill to send people money to keep the airline industry going, to help with the hotel industry and so forth, to pay people for unemployment. Because right now you could barely guard your house. You're like a prisoner in your home. You know, it's like you have stay at home. You see all these commercials telling you stay at home. That's the way to stop this virus. Stay at home. And you can thank Donald Trump. I mean, as much as he says that he doesn't know what have you, that's a lie. So anybody who looks at this video could research for themselves. I know you will never hear this information on Fox News because they're a bunch of propagandists. They're right there for Trump. They're not a real news service. They do a disservice to their people. And unfortunately, some of his people are dying right now due to this virus.